Hi, I'm June, the pharmacist. How can I help you today?
Well, my name's Lucy Elliott. I get all of my prescriptions filled at this pharmacy here, and I have this new prescription from this morning, but I don't want it filled today. I think you could just put it on file.
Okay, for sure. I guess with that in mind, would you mind if I just maybe quickly went over with you a little bit of what the doctor talked about and everything? Sure. So I guess to start off with, in addition to the prescription, did you have any other questions or concerns?
Well, while I was here, I was going to get you to help me find something just to help me sleep.
Okay, for sure. So I guess just to make sure that I have a clear picture of your medical history, I just kind of want to go through a little bit of that for the first few minutes. That would be okay.
Sure.
So I guess in addition to your trouble sleeping, what kind of other medical conditions do you have?
Well, I've got high blood pressure and high cholesterol. And one of the pills I'm taking is for nerves.
Oh, yeah. For nervousness, I guess?
Yeah.
Anything else? And I guess of those three conditions, the high blood pressure, the high blood cholesterol, and then a little bit of nervousness, I guess. How are those doing for you?
I think okay. I've been a bit tired lately, but yeah. I think everything's okay.
Have you measured your blood pressure recently? Or do you know what kind of numbers?
I don't know, my doctor measures it, but I don't really pay that much attention.
Did Dr. Lund mention anything about that? Nothing?
No, the only thing he said was he just gave me this.
In addition to that, out of your immediate family, what kind of medical conditions do they have? Like your mom, dad, nothing?
Nothing particular, no. Well, my sister had a stroke a couple of years ago.
Do you know the age?
It was 4 years ago, and she's 3 years older than me. She was in her early 70s.
So next I want to ask a little bit about social history, a little bit about, I guess, smoking, lifestyle kind of things. Those they do affect your blood pressure kind of thing. So I just want to go over a little bit of that. So I guess, have you ever used tobacco products before?
No. Well, I smoked for about 2 years when I was in university years. Yeah, it's been years. No, I don't smoke.
So in terms of alcohol, so I guess on a typical week, how much do you drink? How would you say your nutrition is and diet?
I think
Do you follow kind of food guide or kind of thing? Or?
more or less. Yeah.
That's good. Yeah. How about exercise? So on a typical week, how much can you squeeze in?
We go for walks occasionally, but there's nothing on a regular basis.
Do you have anyone in your family who goes on the walks with you?
My husband, yeah.
So I guess, so in terms of allergies, what medical allergies do you have in terms of medications?
I don't have any.
So go into a little bit of your medication. So you did mention that one was for high blood pressure, the Ramamil. Is that one okay? No? That's
I don't think so, yeah.
The next one is the aspirin.
Yeah.
Have you had any histories of, like, I guess, a heart attack or stroke or anything like that? No. Did Dr. Lund suggest you start aspirin?
Yeah, he just thought it'd be better. I think with my sister's stroke. And my blood pressure.
And then for the torvastatin at bedtime, for your that's fine as well? No muscle aches or anything?
No, seriously, no.
Okay. And how about the citalopram for your nerves?
It seems to be helping.
Okay. Yeah. So I guess overall, maybe in the past week or month, have you felt nervous at all, or something that came out as that sort of?
No. Not particularly, especially.
And in terms of, I guess, your blood work for potentially the high cholesterol, has the doctor gone over that with you at your visit when you went to see Dr. Lund?
He just said everything was fine, yeah.
Sounds good. In addition to that, any other products that you take over the counter without prescription? Any herbals, vitamins? In terms of remembering to take medications, I guess again over the last week, have you, or on estimate, would you usually miss a few, or how many doses would you miss on an average week?
Oh, not an average week. I don't miss any. Very occasionally I'll miss the one at bedtime, but usually I remember. So.
Oh, that's great.
Yeah.
So whatever you're doing seems to work for you. That's great. In terms of, I guess, any of your conditions affecting your daily activities, have you found it like that? Any, like your ability to function? No? So, I guess with this medication, did Dr. Lund tell you a little bit about why he was possibly prescribing it to you?
Well, he told me that my blood sugar was high and that I had diabetes, but I don't really think I have diabetes. I maybe borderline, but I don't think I have diabetes.
Did he tell you some numbers that you got on the lab report that make you think you have diabetes?
He's at 8.
Was that your what's called an A1C or your fasting blood glucose?
Maybe so it was my blood sugar. I don't know. Yeah.
Blood sugar?
Yeah.
I guess next I want to talk to you a little bit about your diabetes and your sleep, of course, as well. So I guess with that in mind, did you want to discuss your diabetes first, that your doctor's prescription that your doctor was considering for you, or did you want to discuss a little bit about your sleep first?
It doesn't matter. I just don't think I need that one. So
Well, I guess since you were concerned about your sleep, let's start with that first.
Okay.
I guess tell me a little bit more, I guess, over the, how have you been finding? Have you been having trouble falling asleep or waking up at night?
Yeah, I wake up. I usually fall asleep okay, but then I'll wake up and I don't know, I wake up and so I'll get up and walk around, go to the bathroom, go back to bed, but I have trouble going back to sleep. So,
are you finding that you have to wake up to go to the washroom? Is that what's waking you up, or you just find yourself waking up?
I don't know if it's waking. I usually get up and go when I wake up. I go to the washroom, but I don't know if that's what's waking me up.
Has it been consistent? I guess, or
it's been more frequently in the last little while. It's been more. So I guess a couple of days.
Could you maybe estimate how often is it? Is it every day, every other day?
Pretty much every weekend. Pretty much, yeah.
That does sound frustrating and
Yeah.
affects you. Said you were
Yeah, I've
feeling
been
tired too.
tired,
In addition to that, any other symptoms, or just feeling very tired and just having difficulty going back to sleep once you wake up again?
Yeah, that's my thing.
Has this ever happened before?
Not really, no.
So, did you say it started a few weeks ago?
No, probably a couple of months ago. I don't know. It's going on for quite a while. Long enough that it's, I am sorry.
Anything that you find makes it worse, I guess?
I haven't made any connections.
I didn't ask earlier, but as well, do you usually drink coffee or tea?
Not at night.
Not at night, okay.
No, I have coffee in the morning.
I guess when you go to bed, could you maybe describe to me a little bit of your routine before going to bed to see any
No, we'll usually watch the news and then we'll read for a bit and go to bed.
So I guess when you do wake up, do you feel dizzy at all or in sweats or anything like that?
No, not really.
So just get up and go to the washroom and set your phone back. Has your husband noticed you tossing or turning at night or anything, or any nightmares?
No, nightmares. He hasn't said anything.
So I guess the only
He knows I'm waking up in the middle of the night, but he hasn't mentioned anything else.
I guess in terms of going to the washroom, I'm not sure if that could be a factor or not, but then a little bit of with like higher blood glucose, that means or blood sugar, sorry, your body sometimes wants to get that out. So I'm not sure if that starts waking you up because you weren't exactly sure of that. But the potential cause, I'm not quite sure otherwise. You said you don't drink caffeine at night and you kind of watch the news for a bit, so I'm not sure what So with that, did you want to try to do something? Because it could potentially be higher blood sugars that's making you go to the washroom at night. Would you like to do something with that, or would you want maybe a medication to help you sleep? I guess where do you want to go from there?
I just don't wake up every night. I don't know what's the best way to handle it. What's the best way to
Because it sounds like the way you're going to bed sounds fine to me. So, did you maybe want to try discussing your diabetes a little bit first to see if that's a potential cause? Maybe do that for a few weeks. If it's still a problem waking you up, we can maybe look into other medications that could potentially help you sleep.
Do you think it could cause it? Is that what could be waking you up?
Because you do say you are going to the washroom.
Yeah.
I guess overall, are you finding that you're going to the washroom more frequently?
Well, maybe. Yeah, I haven't really kept track, but yeah, possibly, yeah.
Any other symptoms, like thirsty?
Not particularly.
Do you have anyone else in the house? Pets or children?
This is my husband.
So, I guess it's kind of, I want to say, I wanted to leave it to you for your choice because I want to, I guess, see what you want to do best, like whether you want to.
I just thought maybe a sleep aid would help me. Yeah. Because I don't really know, but I thought maybe a sleep aid would help.
So I guess with that, there are, I guess, what's called like more like the natural health products route, where people use something like melatonin, some people find that, or we can go in a different route and do what's called another pill, a medication called Consultation, which is a prescription. Would you have a preference of going?
No, I thought maybe there's just something like that.
So I guess we could try what's called melatonin. It's kind of like a natural hormone your body produces. Usually it's pretty well tolerated at the doses it's used at. So maybe try that a few minutes before you want to go to bed.
Okay, sure.
So I'll quickly just confirm the dose and I can get back to you on that. We can discuss that for sure. And you can, I guess, try that for maybe a week or two, I guess. And then if you're still having trouble, you can please come back and talk to us. Do you have any questions about that? Okay, so I guess now we can move on a little bit to what Dr. Lund was going for. So I guess about diabetes, what do you know so much about that, or so far about that medical condition?
Well, I know a little bit about it, but I just don't think I have it, so I don't see any need to take that because I may be borderline, but I don't think
Does any family members have diabetes or any friends?
yeah, a couple of friends who are diabetic. But one of my friends has numbers higher than mine, and she's not taking any medication. Her doctor told her just to watch her diet. I have another friend who's on medication, and she's had some really bad reactions to it. Very dizzy and sweaty and really.
Did Dr. Lund go over with you potential causes of why we want to prevent diabetes from getting worse, having too high blood sugars?
Not really. He just said I should take this.
Sure. Would you like me maybe just to go over that with you, and then after that we can go over potential options, I guess? Like would you say if you don't want to start this meds now, we can look into alternatives? That's alright.
Yeah, whatever. I just really wanted it just to be cool.
Yeah, for sure.
Because I don't need to.
Would you mind if I told you a little bit about diabetes, and we can put this on file for sure?
Sure, that's fine.
So I guess with that, the reason why we look at diabetes is because sometimes high blood sugar can cause problems with your kidneys, your eyes. It's a risk for things like heart attacks and strokes. So that's what we want to prevent it. But if you don't feel the need right now for that, there are other ways that people can do it right at the beginning, like what you said. Like your friend is going on a little bit of a diet. You already sound like you're eating healthy, and then exercise as well. So with that can control your sugars if you're motivated to do those things as well. So would that be something you would like to consider instead of starting this meal?
Yeah, sure.
Sure, sounds good. So I guess with that in mind, we can probably try exercise and diet maybe for 2 to 3 months or so. Would that be for you? And then from there, we can see whether it's not working. If it's not really working, we can again discuss about this medication. So I guess with exercise and diet, you already sound like your diet's pretty good. So would you like to